Infant CPR is a life-saving skill that every parent, caregiver, and individual interacting with infants should know. It can be the difference between life and death in situations like choking, near drowning, or any incident where an infant stops breathing. Knowing infant CPR empowers you to act quickly and potentially save a life. Time is of the essence in emergencies, and immediate CPR can significantly improve the chances of survival for an infant in distress. It's natural to feel overwhelmed or scared at the thought of performing CPR, but remember that even basic CPR knowledge can make a huge difference. The steps are straightforward, and with a little practice, anyone can learn them. Don't hesitate to seek out CPR training from certified instructors. Learning infant CPR is not about becoming a medical expert, it's about equipping yourself with the skills to possibly save a life. You might be surprised how empowering it feels to know that you can potentially make a difference in a critical situation. Take the initiative to learn infant CPR. It's a skill that could one day help you save a precious life. Before rushing to help an infant who appears unresponsive, quickly assess the situation for safety. Your safety is paramount. Look around for any potential dangers such as traffic, water hazards, or electrical wires. If the environment poses a risk to you or the infant, try to move to a safer location if possible. Once you're in a safe environment, check the infant's responsiveness. Gently tap the infant's foot and call out their name or say something like, "Are you okay?" Observe for any signs of movement, such as stirring, coughing, or crying. These are positive signs that the infant is responsive. If the infant doesn't respond to your touch or voice, it's time to check for breathing. Look at the infant's chest to see if it's rising and falling, a clear indication of breathing. Listen closely to their mouth and nose for any sounds of breathing. If you don't see or hear any signs of breathing, it's critical to act quickly and begin infant CPR. If you're alone, shout for help immediately. If someone is with you, tell them to call 911 for emergency medical services while you begin infant CPR. Speed is crucial in these situations, so don't delay calling for help. Every second counts. Place the infant on their back on a firm, flat surface like the floor or a table. Gently tilt their head back by placing one hand on their forehead and the other under their chin. This opens up their airway. For infants under 1 year old, use 2 fingers, your index and middle finger placed at the center of the chest, just below the nipple line, to perform compressions. Push straight down on the chest, about 1.5 inches deep. Compress at a rate of 100 to 120 compressions per minute. After every 30 compressions, give 2 rescue breaths. To give a rescue breath, seal your mouth over the infant's mouth and nose, creating a tight seal. Gently breathe into the infant's lungs for about 1 second per breath. Watch for their chest to rise as you give the breath. Continue cycles of 30 chest compressions followed by 2 rescue breaths until help arrives or the infant shows signs of recovery. Remember to avoid excessive ventilation, as too much air can be harmful. Minimize interruptions during CPR to maintain effective blood circulation. Stay calm and focused throughout the process. Regularly practicing infant CPR using a mannequin or attending refresher courses can significantly boost your confidence and competence in real-life situations. Knowing how to perform infant CPR is an invaluable skill that empowers you to act swiftly and potentially save a life. Remember, you don't have to be a medical professional to make a difference in an emergency.